Hi everyone, this is Leanne. Welcome to From the Heart, and today I have an episode on prevention for preventing tick bites and hopefully preventing Lyme's disease. And this is something that feels really brand new in the world of medicine, and I basically knew nothing about it until I had a client that presented with Lyme's, and it was her naturopath who helped diagnose her. And in the conventional medicine world, she was diagnosed with something completely different. And so because of that, and because of how she would express her experiences, because when I run into my clients, I love to talk to them, she would tell me that she would sit down with people and they would know nothing about what to do with her. And so then I decided that I wanted to know a little bit more so that I wouldn't be one of those people that know absolutely nothing, even though I'm not an expert whatsoever. I actually asked my naturopath, Erin Kasparek, to be here so she could answer some of the questions that I have. And I know that it's a topic that a lot of people have questions about, and there's a lot of fear around it. So, I think that information can be good at alleviating fear. So hopefully that's what people can use this for. And it's just a place to start, basically. So, Erin, I know that you got some training. You do have some experience in treating people with Lymes. Do you want to tell us what it is that you have experience?
Who I am. Yeah. So I'm an Ottawa-based naturopathic doctor, and I started my practice treating a lot of babies and pregnant women and fertility, as all maybe naturopaths start, and treating sort of bloating, irritable bowel syndrome, and those sorts of things. And then I started to collect a small group of patients that did not follow the typical presentations of like a classic like single system illness, like if your symptoms are just isolated to your digestive tract, or you just get migraines, or you just have acne, or it's relatively simple to identify what's going on, find the root cause, offer interventions, resolution, in like 3 months. And I would say in the first like 8 years of my practice, if someone changed their diet, like they improved. They maybe didn't notice all of their concerning symptoms resolve, but they improved a lot. And I saw a collection of patients coming in that did not work. They would do like a paleo style diet or an elimination diet or remove gluten, and like nothing would change. And then I was like, their lab tests were usually normal, but they would have these symptoms that would be considered like multi-system, like complex chronic illness. So symptoms that are longer than 6 months, that haven't necessarily been like, no one's really put the pieces together in terms of like a holistic like diagnosis. And usually that encompassed pain, fatigue, neurological symptoms like tinglies, brain fog, headaches, vision changes, balance issues, and sometimes like cardiovascular, like heart palpitations or chest tightness or respiratory issues, or like hormone imbalance, blah, 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 blah. Like the list goes on. And that doesn't really fit like the conventional medical model, like one system, like one treatment, easy peasy. And so that is when like it's frustrating when our patients don't get better. And you feel like someone's like asking you for support and you don't have the tools. So I started going to these conferences that were focused on like complex illness in the US primarily. And they started talking about things that I had never heard of, like mold toxicity and vector-borne infections like Lyme disease, or, this like pre-COVID, like chronic viral fatigue, chronic viral illness, or like latent infections that are of a viral nature. And it kind of like opens a whole can of worms, a whole different approach to like diagnosis, medicine. It requires like a full toolbox and many practitioners and a full holistic like look at the person and what is going on. But often there is an underlying like infection if there's pain and fatigue. And there's an involvement of multi-systems. And I would say the most common chronic set of infections are like those Lyme diseases, you know? And so we say Lyme and we think, like, technically Lyme disease is Borrelia. Like, it's a spirochete. It looks like a little spiral bacteria that kind of behaves like a parasite, and it can be transmitted by tick bite. So like a tick that's carrying Borrelia because it like maybe bit a deer that was also carrying Borrelia, but then bites a human. You know, ticks are teeny. They're like poppy seed size sometimes. So like sometimes you don't even notice. They like embed, they kind of burrow into the skin, and they like transfer some of their saliva, it mixes with our blood, and that's like how the infection is usually transmitted. Although like fleas and spiders and other, you know, insect vectors can carry Lyme. So it's not always a tick bite. And then because it does exist like in our blood, in our fluids, like it can be sexually transmitted, or, you know, for you, vertically transmitted, like from mom to baby. Like can cross like the placental barrier in pregnancy. And so, you know, that's like the classic like Lyme. But in reality, ticks and fleas and spiders and cats and dogs like carry a whole host of bacteria and parasites. And so if a tick bites and transmits whatever infections it is carrying, it's often more than one. So it's often Borrelia plus what are referred to as co-infections, Lyme co-infections. And they're like the most common, I would say, in Ontario are like Babesia, which is sort of like a North American malaria. It's transmitted by black flies, ticks, causes sort of like these night sweats, big fevers, chills, a lot of anxiety. Bartonella, which is like cat scratch fever. It's usually transmitted by ticks and fleas or through infected cat bites and scratches. It causes a lot of like pain, aches, fatigue, like depression, muscle soreness, like cysts, lumps, lipomas, a whole host of those sorts of things. And then there's another sort of set of maybe 7 or 8 bacteria like Rocky Mountain spotted fever, Ehrlichia, Anaplasma, you know, like all of these names that we don't necessarily think of as infections. Like, you know, you think infection, you think strep throat, right? Like I'm gonna go, they're gonna swab my throat, I'll get amoxicillin or whatever for a week and I'll be better. But these are not they're not as easy to test for. They're not effectively treated with 7 days of antibiotics, and they're difficult to identify. And so I don't really follow the pattern of like infection that we normally think of as, you know, I got sick and then I got better. It's like this longer process with the immune system. It's like a very long-winded way of explaining Lyme disease. Yeah.
Yeah, and you went right to the next question, so that's great. And then you went into the symptoms to look out for. Are there more symptoms that you want to add to what you just said?
Yeah, like if you had to sort of like look at a stick person and maybe like bingo stamper the areas, I would say that kind of like splitting headache or like worst headache of your life, you know, like that's a classic Lyme symptom. Some people get headaches that are like temporal. Some people get frontal headaches. Some people get on the back or the band. But it doesn't really follow the normal like migraine, barometric pressure, hungry, tired pattern. Migrating joint pain is the keynote symptom for Lyme disease, like because they're like those little spirochetes, these little, you know, like little pigtails kind of. They can burrow, and so they love collagen. They can burrow like into the joint space, and so patients will say things like, I have knee pain for a week, and then the next week I wake up and I have like arthritis in my shoulder. And then like that gets better, and 2 weeks later I have like ankle pain. Or, you know, like it's sort of like this moving around the body, which is not typical for pain. Like normally we get injured, we have pain, we go to physio or we take Advil or whatever it is, we ice it and it improves. This is like a different type of pain. I see a patient like the sort of like less obvious. I saw this male patient who was in his like late 30s, early 40s over the course of his treatment, and he had ankle pain that he attributed to playing hockey. But by the time he saw me, he had it for 8 years. I was like, nobody has ankle pain for 8 years. That doesn't make any sense. And he had since stopped playing hockey, but it was like in his ankle joints. And he found, like, he stopped playing hockey, the pain didn't go away. And we treated him with like an herbal intervention for Lyme, and the pain would go away. Like, 95% better. He stops it, the pain comes back. So he did like a longer course of treatment, but he didn't have this migrating joint pain. He had like both ankles, almost like a psoriatic arthritis presentation. But the characteristic is that it lasted a really long time and it didn't get better on its own, and it didn't respond to rest and ice or Advil. And it didn't go away, So like joint pain's the classic. And then I would say like unrelenting fatigue, just like unrelieved by rest, like feeling like you could sleep forever and not feel better. That involves like both like mental, emotional fatigue, just like difficulty cognitively, and in terms of the body, like that classic, like, oh, well, I felt good today, so I went to the grocery store and I did all the things. I went for a walk, or I went to a exercise class, and now I'm out for 3 days. Like, I can't move. I'm on the couch, like sort of like a mitochondrial disorder, where like sort of used up all their energy reserves, and then they don't have the capacity to like build back quickly. So it sort of sometimes it presents as like a chronic fatigue syndrome, or like a fibromyalgia type body, where there's this like physical fatigue, or I find men often say, I feel like crap. It's like the wording. I feel like total crap. I feel acidic. I feel like sick, but without the classic like lymph nodes or throat, like, type of thing. Although some people do have these like kind of chronic inflamed lymph node enlargement, chronic kind of like irritated throat or sinuses, chronic kind of like that. Have you ever had a flu where you have like really bad neck stiffness? Just like it's hard to move the neck, it's really painful. It kind of cracks at the neck. That can be a Lyme symptom. And night sweats, which outside of menopause are the menopause transition, are usually an infection sign. Like if you wake up drenched in the middle of the night, your immune system is working, like that's a fever. And so I think people ignore night sweats. Like they attribute them often to stress, which is another cause, but that stress goes away usually. Whereas like, chronic infections don't just self-resolve. So those would be the other kind of classic. And then some people get these like less common symptoms, like weird rashes or skin issues, or that looks like cat scratch fever, but like basically stretch marks that don't follow like a pattern of normal stretch marks. Like people don't usually have stretch marks like this across their back. They would follow like the lengthening patterns of how we gain weight. And so like those kind of, I find often massage therapists can diagnose Lyme or Bartonella. It's like looks like these purple or white bands across the back. The list goes kind of on and on. There is a male medical doctor in the US named Richard Horowitz, and he was treating complex illness for whatever it was, 20 years. And he was finding like there's no validated questionnaire, right, for Lyme, and testing is not that reliable. So he collected from his patient base the list of most common symptoms, and he created a questionnaire. And so that's really easy as a clinician to present to a patient, or just as a person. It's available online. It's called the Horowitz questionnaire. And it's a collection of symptoms that you check off, and then you add up your total. And if you have a total above a certain threshold, the likelihood of like a Lyme or tick-borne infection is very high. So that's a good clinical tool outside of testing. But usually the symptoms fall within pain, neurological, or fatigue. So these are the big categories.
Yeah. Interesting. How can we prevent the spread of Lyme? Or like these?
Yeah, that's a good question. That's a good question, because we don't really know, often in like, let's say the Globe and Mail, there will be an article that's like, increasing rates of, we're finding more ticks, or more people are getting tick bites, like in cottage season, or there's more deer that we're testing that are infected with Lyme, or, you know, when public health collects all these ticks and tests, like there's increasing rates of Lyme disease, or like in people, we're noticing like on public health blood testing, these increasing rates. But it's hard to know, are they actually increasing rates, or are we just testing? So you're like not looking for it, then you won't find it, you know? It's like that we don't know what you don't know scenario. And so I don't know actually if ticks are like, and Lyme is increasing, or if we're just getting better at like identifying it and sort of like better at like narrowing the diagnosis. But there is this suspicion that with like global warming and like a different pattern, like if deer usually walk through a corridor from like, you know, Canada to Kingston, like that's kind of that like Rideau River, Tay Valley, like Westport zone to Kingston is like a very high Lyme endemic area. So near Quebec are very Lyme endemic, and then obviously like sort of more forested areas in out west. But like anywhere there's a vector, like anywhere there's a host animal and a vector in transmission, there can be Lyme. So like if, you know, you bring your border collie in the woods in Canada and a tick gets attached to their like fur, and then they're cuddling with you at night, like that tick can jump or climb over to you and bite you. And it doesn't necessarily, you know, you would never know if you're not like looking for it. So I think in terms of prevention, there's like ways kind of like with mosquito repellents, like there's tick repellents that you can spray on your clothes and your body. You can get permethrin spray or permethrin like wash to wash clothes in. Dr. John Coombs is my colleague. He's a medical doctor in Perth. And anything he says, I trust, you know, because he's been in practice forever. And he's Lyme literate and he treats with autism. His approach is like long pants, like he has work wear, where like if he goes in the brush or the bush or whatever, if he's like hauling, if he's gardening even, you know, he will like put on like his outdoor clothes. He washes them or sprays them with permethrin beforehand. Like it's like a insect repellent that's naturally derived. And then he will go out and he will like reapply maybe like a second like essential oil. You know, ticks don't like lemon, eucalyptus. They don't like cedar. They don't like, I'm trying to think, those like strong smelling, just like mosquitoes don't like it either. The downside is those wear off very quickly, so you have to reapply. But my favorite is like, there's a product called Cedar Side. I think it's American. I don't know if you can get it like directly in Canada. You have to order it across, but it's like a cedar essential oil product that's used. It's commercially available to spray around the house to keep insects from like entering your home or around barns or whatever and gardens, but it can be applied to the skin or on clothing, and it's not like DEET. It doesn't like wear away at polyester or Gore-Tex. Like it's not going to like eat away your clothing, and it's not toxic. And so you can sort of repel them. Obviously, when you come inside, like even if you kind of like a foyer or like a sun porch, you like take off the clothes that you were wearing when you were hiking or mountain biking or hunting or whatever, gardening, walking your dog, and hang them up. Like hang them up outside or like on a porch, like instead of bringing them in. And if you do bring them inside, you can wash them right away, or you can like throw them in a hot dryer for like up to 40 minutes. And that will like cause ticks to drop off and or kind of die. But they can survive like really cold temperatures. So, and definitely like cold water washing is not effective at like killing them. It's like high heat and time. You know, eventually they will fall off clothing because there's nothing to bite. You know, they go searching for like a human or an animal. And then doing like really good tick checks, you know, in folds, like they're like warm places. They're trying to stay alive and stay hidden. So like belly buttons, kind of like groin, cracks, neck, behind ears. In kids, like often kids get tick bites in their scalp, in their hair. and then like along the back. But sometimes they like to like drop out of trees and things. So it is like a good idea to check the head and to just look for like these little black dots or an area of redness or a rash, like that classic bullseye rash, which doesn't always look like that. It can look like a flat, round, sort of like a hive, or it can look like an eczema. Or, some people are allergic to like nickel that rubs on there. They get a contact dermatitis from like their belt buckle. Have you ever seen that, Leanne? I do acupuncture. So like when people go and I go to put acupuncture needles at the belly, often I see this like red raised rash, like where someone's nickel belt buckle is or the button of their jeans. And it can sometimes look like that, but in a spot that doesn't, the classic eczema is like in the folds or in the hands. Like these are rashes that like appear out of nowhere. They usually last for like 4 to 14 days. And then they can sometimes look kind of like a little disseminated, like band.
Okay.
After like 6 weeks later. Mm-hmm. Yeah. Is it the information overload?
No, this is good because we can always, like, people can always go back, right? So overload is good. And then what happens if we do have like a tick bite, like, or we find a tick on ourselves, or the bite?
Yeah. I mean, I think sometimes it's inevitable, right? Like we can pull our socks over our pants. We can, a colleague friend of mine was telling me she's a mushroom forager and she just bought a tick suit off of Etsy. It's like this one piece, has a hood, it has like cinched double bands at the wrists and ankles. But like sometimes they can climb up, they get in. And so if you notice a tick, you can get like tick remover like kits, usually from pet stores or like Canadian Tire, like they're these little kind of pseudo tweezers. You can also just use tweezers. So I would say, if you like hike or mountain bike, like I would put a set of tweezers with your bug spray and your like bear bell or whatever in your backpack and like carry it around every time you go out. If I go biking, like mountain biking, I will spray like around my waist and my neck and my ankles. And even though I'm not in the woods, really, like I'm not touching, there might be like a branch or something. And then definitely if you have a dog and you go to off-leash areas and things, like it's a good idea to spray like yourself, like protect. But if you notice a tick that's embedded, you try to like you pinch it with the tweezers and it'll be like head first, like trying to like, burrow in. So usually you'll see this kind of like a round gut of like this beetle looking thing. And you try to get your tweezers around like the head of the tick and you really slowly pull it out, which is very difficult because usually if you see a tick, you'll panic, especially if it's like on a child. So often people will rip it out with their hands, but the best, that will like break the tick, it'll break the insect, or smush it. And so if you can sort of slowly pull it out, and the tick sometimes will back up a little bit, and then you get it out in one piece, and then you put it in a Ziploc or like a plastic jar with and seal it well. And you can send it in. There's we used to be able to send them to public health, and public health would test them for Lyme, so that they could like map endemic areas where Lyme is really persistent. But in certain areas, including like the Outaouais, Ontario, they feel like they have like public health feels like they have a good map already of like where the ticks sort of are. It's already labeled like a relatively high endemic area, so they don't really collect ticks anymore outside of maybe veterinary or for other research purposes. And so there's a private lab called Genetics, like genetics, but instead of CS, it's TICKS. And that you can submit ticks to them in like a research laboratory that's private, and they will test the tick for like the top 3 infections, like Borrelia, Bartonella, Babesia, or they will do like this extensive like 15 infection panel. And then you sort of pay a premium if you want your results in 24 hours, 48 hours versus like the 5 to 7 days. But it's a good idea to save it. Even if you don't send it in, you might wait. If you get a rash, I would definitely send it in. Or if what would typically happen is you would get a tick bite, and some people go to the emergency room. Some people see their family doctor a couple of days later. And the standard of practice in Ontario conventionally is to give a single dose of doxycycline, which is a broad spectrum antibiotic that can prevent like the replication of the Lyme spirochete. The International Association of Lyme and Associated Disorders has a position statement where they recommend at least 20 days or longer of doxycycline and azithromycin if you have like a bullseye rash or neck pain or a fever, or if you get a flu-like illness after a tick bite, like in the first 4 days, that's like an acute presentation of Lyme. And then if people go untreated, sometimes what can happen is it's like the infection starts to replicate in the bloodstream. It kind of goes into like deeper tissues. And then 6 to 8 weeks later, or like months later, or years later, when the immune system is like down and out, or you're stressed, or you're not eating well, or you have another infection or something, Lyme can like kind of rear its ugly head. And that usually presents as like chronic or latent or post, there's all these different terms for like this chronic state of Lyme. And that's what you want to avoid, because that's much harder to treat and it's much more debilitating than taking 3 weeks of antibiotics like right at the outset. Some people choose, especially with their kids, not to do antibiotics. And so some people will use herbal interventions instead. So there's lots of good herbs at like relatively low doses that will also get the immune system going so it can fight back. But we can also like reduce the replication rate of Lyme and other infections. And so with antibiotics and with herbs, you don't ever know. Like, was it fully eradicated? Did I do enough? How long did I treat? But if you've taken like a gazillion antibiotics in the past, or you get a yeast infection and nauseous and all the things, maybe herbs are like a different option. But the herbs would be more like a naturopath or an integrated medical doctor. The emergency room is not going to offer you like the herbal treatment for acute Lyme. And sometimes they'll test Lyme antibodies if you end up in the emergency room, or a family doctor will do a public health requisition. And what that looks like on a requisition, it will say Lyme serology or Borrelia IgG, IgM antibodies. And sometimes they're high, like sometimes you can catch it. There's about like a 50% validity, on that testing. If it's positive, it's positive. And if it's negative, then you don't know. Like, is it a false negative, or is it? And then there is, I would say, I have seen a lot of patients from Perth and that area. And often there's an emergency room doctor, or their emergency room policy is to test when the patient presents with a bullseye rash following a tick bite, and then to ask the patient to come back like 4 to 6 weeks later, and they retest them again, like after an incubation period, basically, to see if like the body's been able to mount an antibody response through the immune system, like with time. And that's really smart, I think, to screen, like just like kind of like with HIV screening, like antibodies don't elevate right at infection. It's like at least 6 weeks later the testing's done. So very similar, there's kind of like this latent period. To answer the question, like, what do you do? So yeah, you see a healthcare provider. If you get a tick bite, you save the tick, you send it in if you want to know, and you can always send it in like a week later. Like the tick doesn't need to be alive to test the infections that are within it, and you decide if you want to do like kind of the standard 200 milligram one-time treatment, or you advocate for yourself. You can pull up, like, the website is ilads.org. It's ILADS. And there's like a position statement, and these are like the Lyme doctors internationally that have like combed through all of the research and their clinical expertise and have said like, this should be the standard of care. And it just hasn't yet been incorporated into like, public health or hospital guidelines. So you do kind of have to push a little bit for that if it's a treatment that you want to do, or naturopathic doctors, if they're Lyme trained or Lyme literate is the term, often carry, like we carry at the clinic. It's like an herbal mix that's very specific for like post-tick bite. And usually I would recommend it for like 6 to 8 weeks, just to like be really safe and like monitor for symptoms like fevers, pain, headaches, joint symptoms, or fatigue. Mm-hmm. Because it's interesting, like a lot of people who present with Lyme disease are otherwise healthy. Like on the surface, they look healthy, like they were 30-something-year-old, whatever, working full-time job and active and eat relatively well and like go from essentially being like in a healthy state to having like severe knee pain, not wanting to get up in the morning, having to go to bed at like 6 p.m. So like no activities, like no time with their kids, not going to hockey, like all these things. And then chronically, like after several years, often people go off work because they have so much fatigue, they don't want to use up all their energy like in their job, or they can't function in their daily activities like work because of the amount of brain fog and fatigue or pain. And so there's kind of like this progression if it goes untreated. And that's really sad, because in a perfect world, we would treat early because the outcomes are so much better. And then people are not losing like time in their life. And obviously, like if you're in pain and you fatigue, like there's usually concomitant like depression and anxiety and insomnia and all of the least favorite symptoms that really affect like our quality of life. Mm-hmm. So for that reason, I would say, and if you are a person who has all of those symptoms, like I would undergo, you can do Lyme testing at any time. Like you can request it from your family doctor through Ontario Public Health Screening. You can go see a naturopath. They can do certain limited testing. Nurse practitioners can order Lyme testing. Can you order as a midwife?
I don't think so.
Outside, yeah. Some tests are outside our scope of practice too, like Epstein-Barr virus and that sort of thing. Yeah. Mm-hmm. Yeah.
Yeah. Thank you. That answers it well. So I know that there's a lot of misconceptions and things like that. Is there one that you really would want the public to know or healthcare practitioners to know?
Well, yeah, that's a good question. Definitely Lyme doesn't always present with joint pain. There is like a clinical diagnosis that's named neuroborreliosis. So it's like when the Lyme spirochete or a co-infection basically like invades the like microglial cells in our brain, our macrophages in our brain, our neurons, and it looks like functional neurological disorder, loss of balance, like weird vision changes. Well, not just blurry vision, but like, you're fine in the morning and then your eyes are blurry at night and they get like visual snow for the rest of the evening. Like that's bizarre. It sort of can look like multiple sclerosis, it can look like a demyelination disorder. It can look like neurological celiac. And so that's why a lot of practitioners don't treat Lyme, because it involves like ruling out all the other things that can look the same before you come to like a Lyme diagnosis, because it really is like a clinical diagnosis. It's made on the basis of symptoms, not on testing alone, because Lyme evades the immune system. There often isn't an antibody response. And like, that's how we test for infection. Conventionally, like we look for antibodies to COVID, antibodies to strep, antibodies to whatever. And so it's hard to like trust the lab value like exclusively. The other type of Lyme that's less common is like cardiac. It kind of presents with like essentially heart palpitations or chest pains or dysautonomias, like blood pressure high, low, heart rate really high, really low, like a lot of like postural dizziness, fainting, like that sort of symptom pattern. And that can obviously be due to a whole host of triggers, like, inflammatory triggers for our body. But that I would like get my little radar up if someone has really high blood pressure and they're in their 20s, for example, or really low blood pressure in the like they can't go to the grocery store for 15 minutes or they'll faint, you know? Excuse me. And so I would just look at things like with a little bit of a different lens, like if something gets diagnosed as MS or early onset dementia or pain due to injury, like just think a little bit outside the box. Like maybe there could be like an infectious origin and maybe it's worth testing for.
Thank you, Erin. So there's the people who have a lot of fear, and everyone that I talk to. So my dad's a forester, and then I hang out with healthcare practitioners because we have things in common and stuff. And everyone who knows about Lyme always says like keep going outside. And I just want like, do you have anything to say to the person that has like an immense fear?
I know. I think like we can use all the preventative measures we want, and we can still be exposed to like a flea or a tick, you know, like if you pet a cat when you're walking down the street, like you never know. These are like there's infections everywhere. Our body is full of bugs. And most of the time our immune system can handle it. You know, we have strong bodies. They're very resilient in the absence of like toxic exposures, heavy duty stress, lack of sleep and nutrients, you know, lack of sunlight. But the benefit of like movement and being outside and the sun like far outweighs the risk associated with like maybe acquiring a tick bite, maybe then manifesting an infection. I have 2 colleagues who went mountain biking together. They're both Lyme literate. They were in Canada. And they got home that night and they both noticed tick bites like under their bra line. And one took antibiotics for 6 weeks and the other treated with herbs, but they were in the same place at the same time. You know, they weren't like in the deep woods. They didn't like manifest symptoms in the same way. Kind of like with other infections, like, you know, we can be exposed to COVID and not manifest like the infectious signs of COVID. One person might have debilitating respiratory, you know, pathology, and another person might have a headache for 2 days and then recover. So it has like a lot to do with like how our immune system works generally. And if we take really good care of ourselves, we keep a buffer, you know, like you keep basically an immune buffer, like a shield where your immune system, like just on its own by virtue of how we're wired and programmed, how our bodies work, can like fight back. It's just if there's a vulnerability, if there's like a breach in the system, you know, Lyme happens to be like a sneakier bug. You know, it evades the immune system. It can replicate quickly. It's called pleomorphic, you know, it has these different forms. It can like live in the bloodstream, but it can also live in our own cells. And so that's what makes it so tricky. But it's also treatable, you know, like it's difficult. It takes time, but it is an infection and it thrives in an environment where there's, you know, more alcohol use, more drug use. If you live in a moldy home, you know, eat like high nutrient dense foods, et cetera, like those things matter in terms of our immune system. Like we know this from COVID, like if people that had metabolic disorders like diabetes and hypertension, pre-existing inflammatory conditions had worse outcomes. And then there's protective factors like being active and having a healthy kind of BMI and in the end. So I think our best bet at staying healthy, whether it's defending our bodies against like an invading bug or preventing like chronic illness due to a sedentary life, you know, in chips, is to just like take really good care of ourselves and like at the onset of symptoms, try not to like ignore them. You know, it's normal to like, if you have a health symptom to say like, okay, I'm going to wait 6 weeks if it doesn't get better with like my own hacks. then I'll go like see a medical professional. But with symptoms like this, it's really important to go early because you want to like get ahead of the treatment. But I would say like I think about it, like if I go out into the woods, I definitely like use a spray and I wear long pants and I check when I get back in. I usually have a shower like as soon as I come back inside, and like loofah scrubs, just try to like get things off. But I have never seen a tick on my own body. And then there's on the flip side, I will see like, I remember seeing a patient who lived in Canada, Stittsville, and her kids went to forest school, and she brought her son in because he'd had like an inflamed lymph node for like 6 months, and he'd had a tick bite the summer before on his head, and they treated it, but she wasn't really sure because this lymph node was still big. Like, maybe we need to treat. And in my office, she was kind of like combing his hair, like mom's, like she was kind of like soothing him. He's like 3 or 4, and she pulled a tick off of his hair and put it on my desk. Like, I can't remember to this day, like grabbing a Ziploc and putting it in. And she was like, this is so weird. His last time at forest school was 3 days ago. He literally like hasn't played outside in 48 hours. Like his backpack hangs outside. His clothes are all fresh, new, washed. Like, where did this come from? And so it's not like being outside that is the risk factor. That like they exist, and like we, I think, can depend on our own bodies to like do a lot of the work for us. And then at the sign of something not quite going, like at the sign of an inflammatory symptom, like test and try to treat like quickly. Yeah. But I do think like there is a resilience factor through our habits and our like mindset, and that like makes us really kind of bolstered up and strong immunologically.
Yeah, that's a really good answer. And then I have questions. I'd really love to know the answer from a naturopath. So I love to talk about community building or quality relating. So this is like getting off topic. Just because we always talk about food, and I think that there's more than just food for good health. And I think that community and just like people that you love give you purpose to actually change your health around and that kind of thing. Do you have things to say about the importance of community building or quality relating?
Oh my goodness. I think you're right, Leanne. Like that's like bang on. I think from as a person, I know that if I'm in a bad mood and I spend time with my friends or my family, I feel better. Like it's the immediate cure. I never feel worse. I might feel tired, but I don't feel like emotionally worse. From a medical perspective, like from an evidence-based perspective, like we know that loneliness is a worse risk factor than like smoking. Like being isolated and the subsequent like depression and changes in lifestyle is like, terrible for our health. And like, it doesn't mean you have to have a family of 5 and be married and be like Velcro to everyone that you love, but you can like smile at the grocery store attendant. You can like look at people when you're out for a walk. You can like, we live in like a very isolated, I don't know, I don't really go to the mall anymore, like since the pandemic. I went to the mall a couple weeks ago. People are like zombies. It's like walking around, no eye contact, no facial expression. It feels kind of like apocalyptic to me, like this whole like the level of disconnection. Like we're kind of scared of each other or bothered by each other or annoyed with each other. And like people are so interesting. Like if we communicate more and we're together more, we learn more, we like grow, our brains like develop and stay engaged, like the best thing. And so I agree with you. And I think from like a health standpoint, I mean, the dream is that like even healthcare delivery could be offered in a group format. Like that would be amazing, because things like a diet for diabetes prevention, or, like what's the value of sleep? What are the things that interfere with sleep quality? Those are universally applicable to humans, regardless of their age, gender, socioeconomic status, etc. And so like that kind of health delivery, like lifestyle, diet, like health promotion is much better suited to like a group environment than like a one-on-one, like, why are you sick? Let me tell you what to do. That's like a disease model of healthcare, and like a growth kind of mindset of healthcare, it would be to do it together. And I find like I run like this 7-day like clean eating program twice a year in the fall and the winter. And it's really hard to sell people on it. Like people do not want to do their healthcare in a group. They do not want to share. They do not want to be vulnerable. But they stick with it, and it's more fun. And I would say like hands down, people find dietary changes like more sustainable if they do them with other people from an accountability and just like community, like fun perspective than deciding like on their own in their own little silo, like I'm not going to eat gluten for 4 weeks, Yeah. So I think that is the key. It's just not how our healthcare model is set up. And I even sat like 2 years ago, I was at a conference, and the woman sitting next to me at lunch runs the group health program at the Cleveland Clinic. So they have like a group wellness. I think it's like a diabetes treatment prevention model, and they can't accept patients right away. So when they're in their waiting phase, they're like, we have this program. It's 4 to 6 weeks. You can join. It's really cheap. It's like, with a health coach and a doctor, and you'll like do all this stuff in a group. And she's like, on a good day, we get like 7 people to sign up, like in a quarter. And that's the Cleveland Clinic. Like they're like renowned. So I think even with their like marketing, it's still really difficult to like shift the model or delivery out of this, like you only go when you're really sick. You only do this like transactional thing where like you tell someone your problems and they give you solutions in 20 minutes or 30 minutes, or if you're a naturopath and you're lucky, like 45 minutes or an hour.
Yeah.
But I don't know how like a standard family doctor, like in 7 minutes can like listen, diagnose, assess, treat. Like to me, that would be impossible. It's like a hello, 7 minutes. Yeah. So I agree with you.
Anything instead of just be able to say, is your baby kicking? Your blood pressure is good. See you later. That's it.
Exactly. Right. Even explaining like, okay, this is how you collect a urine sample. Like that takes 3 minutes. And so, this like time model is not as effective necessarily. I mean, in a perfect world, that's sort of like old way of medicine of like going to someone's house, like seeing the whole family in one visit. You can like smell their air quality. Like, does it smell like cat urine? Do you see black mold? Do you notice that like they're like whatever laundry machine is unplugged and they ripped up drywall? Like you see all of these things and you notice like the interaction between the family and the like dust or like if everyone has allergies in that house, like oh, maybe this is the origin of it. Like I think it is like a different way of like evaluating someone's like environment, and our environment, like not even talking about diet, but just like who we spend our time with and like the air we breathe and the water we drink is like so important to our health. We like forget as humans that we're like part of our natural environment. And it's like a huge influence on how we feel and how our bodies function. But that's not a very profitable model. It's very hard to make money driving across the city, seeing 4 people in a day versus an office where you might be able to see 12 to 15 people because they've come to you and you have all your stuff all set up.
Yeah, it's true. I think the most home visits I've been able to do in a day was 5.
That's a lot.
Yeah, that's an exhausting day.
That is impressive. Yeah, that is impressive. But I think it is more pleasant. It's more pleasant for the people, like the patient, and it is pleasant for us. We just don't always have like access to all our tools that way. Yeah.
just for the part you were talking about accountability in group settings, and then
Yeah.
I was just thinking also expansion could really help. So you see one person heal or get better, and then you realize that you can do the same. And then,
Bingo.
when you see one thing happen, like, and then a bunch of people can do the same. So I think that that's another aspect of community care. But so doctors, I would assume, potentially could make more money when they see for 1 whole hour, maybe 2 hours, 17 people or 7 people, right? So
You can, it's win-win, I think. Like the doctor's not saying the same thing 18 times. They're the people in the group can share amongst themselves, and often in a group of like 10 people, there's like one extra, like super extroverted outgoing person, right? Who's kind of like the cheerleader of the group, or the sharer that like kind of opens the vulnerability for everybody else, like makes it safe. And yeah, potentially they can bill the same amount, like it's, and patients, like the cost of delivery is much lower. So I agreed. It's like there's like a bunch of different wins. It's the kind of like mindset idea, and we're all unique. And so I think as like healthcare providers, sometimes we worry, oh my gosh, what if there's like someone in the group that needs more care, like needs something different, or it's not working for them, or but that is the good opportunity to be like, oh, your health is more complex. Like let's try to like put out the fire over here in a one-on-one visit or with more testing, and then we'll come back. Still participate in a group,
Yeah.
Yeah. Mm-hmm.
And then my last question is on intuition. And so, because I really believe that, because I've seen it, people make decisions based on their intuition rather than my recommendations or someone else's recommendations. And so I'm a really huge advocate of that. And I'm just wondering if you have something to share around that.
I mean, I think like if we're operating on this idea of like health autonomy, like that we get to choose, like it's our body and we get to choose, like from a food perspective, what we put in it, from a medication or a supplement or a whatever, like we get to decide the inputs, and then we like watch, like we have a level of self-awareness where we can like watch our body systems, like, some people like don't have the ability, like they don't feel pain, they don't notice when they have to go to the bathroom, they like, there's like a total disconnect from the body. And so I think if you cultivated awareness with your body, intuition, it comes naturally. If there's trust, if you kind of like learn to trust yourself. And I don't think it's a negative thing to like enlist like education from healthcare providers, but like that is our role. Our role is to like educate, provide guidance, distill, medical recommendations, knowledge. Like not everyone has the privilege of like becoming a midwife or going to naturopathic medical school or, becoming an endocrinologist. Like it's a tough go. And we don't all have like that time or resource. And so the goal of, I think, the medical provider is to like try to distill it down enough that you can explain it in a way that like empowers someone and like allows them to like choose their options. And like that takes time, and it takes like a lot of like trust both ways, like in the patient to trust their healthcare provider that they're not trying to like coerce them or persuade them, and in the patient or the individual to like know and feel like what is best for them, like for every situation. And sometimes like we make the wrong call and knowing that that is also okay, or maybe wrong is not the right word, but like that there's an outcome that we didn't expect, and that you can always change your mind with your health. You're not locked in to like one path for the rest of your life. But I do think like the most like rewarding for me patients are patients that are like self-aware. They're people that want to know more versus like the tell me what to do. Because the second like a patient asks like, can you fix me? Just tell me what to do. All the responsibility then falls like on me. I'm like, I don't have any control over whether or not someone's migraines go away. Like, I can't follow them home and make them drink water and make them go to bed on time and ensure they're eating well and all of the contributing factors. Like, all I can do is like provide the guidance and like motivate and try to provide like a bit of like proof that like this helps other people, or the research shows it helps some people. This is what we think is going on. And then people can kind of like take it from there. But yeah, I'm with you. I often don't do it. I'm like asked to do medically by my like whatever it is. Like if it's a physio exercise and it hurts, like don't do it. Modify it, ask for something different. If it's a supplement and it causes nausea, or a medication that causes nausea, like, oh my gosh, you don't have to take that one. There's probably another option. There is this like no pain, no gain idea with health. It just like doesn't apply, I think. So yeah, I don't know. I feel like we could talk about that one forever. But you're the only person that's ever going to live in your own body. Like no one else is ever going to understand like your pain threshold, your emotions, your internal world. You know, maybe if you get really lucky and you have a best friend or a partner or a parent or who really wants to understand you, like they might get close. But in terms of like, there's so many different feelings and sensations in our bodies at any given moment. We're the only ones, and we have like one lifetime or maybe more, but one lifetime in this body to kind of like learn from it. And so I think like that's kind of the fun, right? Like, how does it make me feel if I spend time in the sun? How does it make me feel if I go in the water versus running? How does it make me feel if I like focus on really deep breathing at yoga versus like trying to do the poses, right? Like, how does it make me feel if I eliminate caffeine for 7 days? Like, it's just learning how your body like responds to different inputs and trying to like follow what feels the best, you know. In theory, you can think about it like a fun exercise. Like, I don't think being healthy has to be like so stressful and like so much work. I think it can be easy. And some people are maybe blessed with like easier genetics than others, or easier like life circumstances than others, but we all have like the potential to feel really good. That's what I like wish for all my patients, you know, that they just like that their bodies aren't in their way, you know, that their symptoms aren't like interfering with their ability to do the things they want to do, the things they love, or to like contribute to the world like in a meaningful way. I think that's the real reason why we want to be healthy. It's not just for ourselves, it's to like be part of like a greater community.
Yeah. That was such a great answer. I love it. Thank you so much for your time, Erin. I hope this episode gets to the people that need it, and that can build their resources and know what to do. Yeah.
Thanks, Leanne. Do you want me to send you any kind of like supportive? Do you ever put like little notes under?
Yeah. So whatever.
I'll send you like a document, maybe just like with bullet points. It's sort of like ideas for tick prevention essential oils and like the ILAD's recommendation for antibiotic treatment if you get a tick bite, or you know, your genetics, the website to test the tick, because that's all the things that are sort of like in the moment when you need it, you kind of want to be able to like find it quickly. So I can send that to you.
Yeah, that would be really great.
Yeah. Great. Thank you. It was lovely. Thanks for asking. Probably we could talk forever. You know, there's like an unlimited amount of information. But those are the key points, the Coles notes.
Awesome. Thank you so much.
You're welcome.